things we just don't like to talk about. Personal things about our bodies, but when we open up about them, you find more and more people are facing the very same thing. On that note, there's a solution to a problem many women face after childbirth. Dr. Bradley Bengtson is here along with Lisa McNeese. Welcome to our studio.
Thank you.
Yeah,
and so we are full-fledged into summer. How are things going at the Bengtson Center?
Really good. We're launching 5 new technologies this summer alone, from a new laser platform to some skin rejuvenation, skin tightening systems, and then the THERMIva system that we're going to talk about today.
Yeah, well, that's interesting, and that's something I think that just when you say THERMIva, a lot of people don't know what it is, but I think a lot of women are very familiar with what it helps treat.
Sure. So it's a touchy subject, right? I mean, so to speak. So there is a brand new system. It's called THERMIva or THERMIva, and it basically uses heat to just very gently heat the tissues in the perineal vaginal area. And it's mainly designed for vaginal rejuvenation, tightening, and toning, but it has an amazing number of side effects that are very, very positive that we'll talk about and explore today.
Yeah, we're seeing a diagram here, and basically the white object is the wand that is used to go in, and it's a heating system.
It's a heating system, and the heat is monitored, so it's very, very safe, essentially painless, and just basically essentially treats the entire vaginal vault, as well as treating the posterior bladder. So,
so people, this week, I know you're going to have an opportunity for people to come in and talk a little bit about what this can do. There are a lot of different possibilities with this, but I think we should further delve into why, and maybe you can talk about why on the medical side, and then Lisa can address it a little bit further from there.
So I think it's very similar to breast reduction, where you get a major cosmetic improvement of the breast, but also you get a major functional improvement, right? I mean, patients have much less neck pain, back pain, shoulder pain, and grooving. So what this does, by heating the vaginal vault, it really increases the lubrication. It posteriorly treats the bladder, and so for mild to moderate urinary incontinence, there's a major improvement there. It increases lubrication, which is a real problem as patients get older, or like chemotherapy, radiation patients, and it's just a very, very unique, system.
And so I know I'm a runner. I love to work out. I know that you have a lot of athletes. You have a lot of moms in general. We joke about this among ourselves that, oh, I can't laugh too hard. Maybe I might go to the bathroom unexpectedly, or if you're running or doing any type of sport, that could happen as well. In your experience, you had this done, Lisa.
I did have it done.
Let's talk about what you discovered through the process.
Well, I did. I would consider myself mild to moderate with the incontinence. I am, a 50-plus woman who is active, and I've had 3 children. I'm soon to be grandmother of 5 grandchildren, and I want to be active and stay active, and having to run to the bathroom all the time is a concern. So for me, having this treatment, immediately I noticed a result, and where before it was, okay, I have to go to the bathroom, it then became a passing thought, oh, I'm going to need to go to the bathroom eventually, and before I knew it, 4 or 5 hours passed, and I looked at my watch and went, oh my gosh, I have not gone to the bathroom yet. So it's impressive. I noticed a difference right away with that.
Yeah, when you underwent the procedure, did you have downtime? Was it painful? What are some of those things that people always want to know a little bit further in, because it sounds great on the surface, but then you think about the other things involved in the process of getting it done.
Absolutely. This is an in-office procedure. It takes approximately 30 minutes. Dr. Bengtson does not perform the procedure. We have RNs and PAs who have been well trained in this and do a fabulous job with it. They are very comfortable and confident when you come in for a consultation. They'll talk with you about what it is that's going to happen and make you feel comfortable with where you're at. They'll talk about your concerns and what it is that you're trying to achieve, and really make you feel comfortable so that you're ready to move forward with that.
Right.
And as Dr. Bengtson said, there's more indications rather than just the incontinence. There's the intimacy sensitivity issues that go with it. We can address those. There's also the lubrication issues. As we age, we get more dry. So there's a lot of things that we can do to help with that.
So this is new. You offer a lot of procedures and services at the Bengtson Center. Why did you want to do something like this, Dr.
Yeah, it's a great question. I think it really completes the entire head-to-toe rejuvenation rejuvenation. And so we do a lot of mommy makeovers. We do a lot of facial, rejuvenation and tightening, both surgically, non-surgically. Do a lot of breast surgery, body surgery, labiaplasties. It really, to me, just really completes the entire, process of head-to-toe rejuvenation. And it's a very difficult area to talk about, right? I mean, sexual intimacy and all these things in a marriage or partner relationship is really, really important. But it's not something that is really easy to talk about. So, I think that for us, we really focus on the very objective benefits of it to try and, get some of the subjective things, because you can really go sideways on this really quick, right? So it really is very dramatic. It's something that is immediately visible, and patients really see a significant improvement right away.
Yeah, we've been talking about head-to-toe rejuvenation. In fact, you have an event this Thursday. People can attend. They can learn more about this and some of the other new technologies that you're really focusing on that are new for this summer and beyond.
Right.
Yeah.
Yeah, it's going to be fun. It's always fun to have new technologies and be kind of promoting things.
You hold wonderful open houses at your office too. They're always very fun events.
Right.
Well, and I think it's important because we have people in our office who've actually experienced the procedures that we do. So, it's nice to be able to talk about this on TV. It's another thing to be able to come into our office and have a woman-to-woman, face-to-face
and ask
conversation.
10 more questions you might be wondering.
Absolutely. Absolutely.
And we're seeing the office right there. You're located in the Women's Health Center, which is quite a hub there on Michigan Street, right down the street from Spectrum Health. A lot of activity there and a comfortable setting where people can come in and they can ask those questions.
Right.
For Thursday, do people need to call ahead to reserve a spot?
They do. We actually have, this is our big summer event, so for a $50 deposit, you will secure a place to come in and view all the different technologies that we have. You will also receive $50 to be used towards anything else within the practice, and we'll be raffling off great prizes, and we'll have some special discounts for that night only, as well as doing a complimentary THERMIva. We'll be raffling off a complimentary THERMIva package. So
it's a great opportunity. I know if people have been thinking about anything like even skin treatments like microdermabrasions or Botox or anything else, it's an opportunity to really come in and meet you and the staff and get those questions answered.
Absolutely.
Yes. Okay, so we'll put all the information online. If you're interested in learning more, you can give them a call or you can sign up for that event. Thank you so much. We appreciate it.
Thank you. Thanks for having us.
We'll be right back with more at West.